Okay, without further ado, I would like to welcome our speaker and presenter for the day, Catharina Giudice, who is an emergency medicine physician and climate and human health fellow at the Center for Climate Health and the Global Environment at Harvard University. So she's going to present for about 40 minutes, and then we will have a discussion. And please feel free to put your questions in the chat at any time. We'll try to get some interaction going there as well. Okay, thank you, Catharina. And I will stop sharing and let you take the reins here.
Awesome. Thank you so much for having me, Justine. And thanks everyone for being here and turning on your cameras. It's so great to see everybody's faces. Give me just 1 second to share my screen and we'll get started. How's it look on your end, Justine?
This is great. Thank you.
Perfect. All right, thanks again for having me, guys. Today we're going to be talking about climate preparedness in healthcare, which is a topic that's very dear to me. As Justine mentioned, I'm an emergency physician. I'm currently doing a climate change and human health fellowship at Harvard, affiliated with the School of Public Health. My focus is on how the healthcare system is going to be adapting to this immense issue that's in front of us. Just to give you a little bit of context, I did my medical training in a hospital in LA. I was already very climate concerned as a civilian, as an individual. And as through my medical training, through my residency, I started to see the immense impact of climate change on human health. Where I trained, COVID hit us really, really hard. The healthcare system was incredibly overwhelmed. And in the midst of this global crisis, LA was seeing some of the hottest heat waves that it had seen in its history. We're seeing some of the worst wildfires that were overwhelming the healthcare system even more than we were already overwhelmed. So it got me thinking of, this very important role that we played in the healthcare sector, not just from a mitigation standpoint and recognizing that we were a big contributor to the issue from a greenhouse gas emission standpoint, but also recognizing that climate change was affecting human health and it was overwhelming the healthcare system and that we needed to be better prepared, which leads me to where we are now. Just a quick outline. I would love to set the stage. I know that everybody here probably has a strong background in climate, why it's happening, where we're going with it. We'll dive into some of the health impacts, but most importantly, how not necessarily it's affecting health of an individual, but how it's affecting our ability to provide high quality care as a healthcare system. And then we'll talk about adaptation strategies that I'm thinking about and some of my colleagues are thinking about. We're already seeing warming. We've reached 1 degree Celsius, and that is causing worsening heat waves, worsening natural disasters, precipitation, tropical cyclones, drought. It's already affecting communities. It's already affecting human health, and it's already affecting the healthcare system. How much we're going to have to adapt is going to completely depend on what future emissions are going to look like. Again, we're already seeing changes. We're already being pressured to adapt to a certain extent, but adaptation is a long-term thing. So nobody knows exactly what the future is going to hold. But if we maintain low emission scenarios according to the IPCC, maybe we'll just have to adapt to weather events caused by a 2 degree warming. If we continue on high emission scenarios, we might have to adapt to 4 degrees, 6 degrees Celsius, which is huge. And nobody knows exactly how the globe is going to mobilize and what trajectory we're going to be leading with our cumulative global emissions. Climate change is affecting human health at an individual level, which I think we're all very familiar with. So climate change leading to rising temperatures, more extreme weather events, rising sea level, increasing CO2 particulate matter, then is going to lead to exacerbation, to specific effects on the environment. Worsening tropical cyclones, worsening heat waves, air pollution, and all of these effects on the environment are going to have specific effects on health at an individual level. So for example, not to state the obvious, but extreme heat is going to cause more heat-related illnesses. So people that are going to suffer from dehydration, from heat stroke, extreme weather events, tropical cyclones, extreme precipitation, flooding is gonna potentially cause more injuries, trauma, drownings. So each one of these effects on the environment are gonna have effects to human health at an individual level. However, the effect is much greater. And this is what I want to talk about, is that we're not just seeing effects to the health at an individual level, but we're seeing effects of climate change on our health system infrastructure as a whole, which can trickle down to all kinds of poor outcomes at the end of the day. And I'm just going to give you guys a few examples. So when we're talking about heat, there's a lot of data out there that's arguing that heat is causing, and you guys can see my screen okay, not my presenter notes.
Yes.
Okay, great. So there's a lot of data out there that's showing that heat is causing a general increase in ED volume and hospital presentations as a whole. This graph over here it was a study published in 2021 looking at heat illnesses and heat specifically. And it's kind of intuitive, right? You're going to have hotter days. And therefore, you're going to have more people presenting with heat-related illnesses. But like I was saying, the data is showing that even things that are not as directly attributed to heat are increasing in volume during hotter days. So things like accidental trauma, like motor vehicle accidents, not accidental trauma, like gun violence, penetrating wounds, assaults. So there are things that are also increasing in volume that are not necessarily intuitively directly related to heat. So as volumes increase during heat waves, we have longer wait times, and longer wait times are going to lead to all kinds of worsening health outcomes at the end of the day. So heat is putting a huge strain in the healthcare system from a volume standpoint. This is another study that was very interesting, published by The Lancet. I think it was in 2015. They look at heat and the effect on mortality overall in 13 cities throughout the world. And they found that the trend was very similar throughout all of the cities. In moderate temperatures, you had this plateau, no increased mortality, but you got to higher temperatures and you had an exponential increase in the relative risk of mortality. Again, arguing that heat is going to lead to increased mortality, and not just heat-related illnesses, but in a wide range of conditions that are going to lead to increased hospital volumes. And then heat has also, I didn't put it here in the slides, but if a city is going through a heat wave and everybody's using their air conditionings, you have a surge in the demand for electricity. And if you don't have a robust electrical grid, then everybody's threatened to lose electricity during heat waves, including hospitals, and including people that are dependent on medical devices, on electricity to run medical devices at home. So that's another way that heat can really affect the healthcare infrastructure as a whole. Air pollution is another climate event that doesn't respect borders, like most of them. We see the direct impacts of healthcare facilities that are close to wildfire high-risk areas. We tend to see, again, the direct impacts of the wildfires to those communities. So people that are presenting with direct injuries from burns, from carbon monoxide, cyanide poisoning, But air pollution obviously doesn't respect borders, can travel for hundreds of miles. I mean, we remember the Canadian wildfires, and the way that the New York City skyline looked during the wildfires. And we're seeing a lot of exacerbations, people with underlying lung problems like asthma, COPD, are having exacerbation of their conditions and increasing hospital volumes during poor air quality days. Hospitals that don't have proper air filtering can also have that same air kind of affect people that are already hospitalized. And we don't really know exactly what that means to health outcomes, but I think it's intuitive to assume that maybe there might be an effect there as well. This was a really interesting study that was published by my colleagues here at Harvard, looking at the number of inpatient beds and their distance to wildfire zones in California. And what they found was, so basically they overlaid high-risk fire areas to inpatient beds, to hospitals. And they found that about 50% of inpatient beds in this area of California was less than a mile away from high-risk fire zones. So imagine what that means for evacuation purposes. If 50% or 10%, 25%, whatever it is, of hospital beds have to be evacuated due to encroaching fires, what strain that puts on the hospitals being evacuated and the ones receiving the evacuees. I mean, that could be a huge strain to our ability to maintain operations. We talked about the direct impacts of extreme weather, extreme precipitation, hurricanes on an individual health from a direct impact. So trauma that can be caused by fallen objects, by drowning. But really the bulk mortality that happens during extreme weather events is related to this profound disruption in the infrastructure that happens during these events. And that can last for days, weeks, sometimes even months. So yes, we see people that are presenting immediately from direct trauma or drowning, but the mortality tail is really long, related to just, again, these profound infrastructural changes. People lose access to electricity, again, thinking of folks that depend on medical devices, on electricity to run medical devices at home, like home oxygen, home dialysis. If they lose their access to electricity, they can potentially have pretty profound, devastating health outcomes. Disruption of roads, of transportation systems, people can't get to the hospital, ambulances can't get to people. And if you depend on regular access to your care, if you're dialysis dependent 3 times a week, or if you run out of your medications and you're not able to get a refill for your life-saving medications, or you're on chemotherapy, like these disruptions to infrastructure can be truly profoundly devastating to a lot of folks. This is an image of Memorial Hospital after Hurricane Katrina, and I think this is an extreme example of how profound our interaction or healthcare system interaction with the environment can be. I just wanted to read, I think this is really powerful, and I just wanted to read a short quote from an article that was published by John Nickel in 2016 that's called Dead in the Water. So here he says, the morning of Wednesday, August 31st, 2005, in the wake of Hurricane Katrina, the last backup generator at Memorial Medical Center of New Orleans provided its last surge in energy and died. Electronic equipment immediately began to fail. The generators went out, throwing the hospital into darkness and cutting power to the machines that supported patients' lives. The generators at Memorial were supposed to function for 6 days. In the end, the floodwaters rose too high, and the precious generators failed after only 2.5 days. As a result, many lives were lost. So again, this is an example of a healthcare system that unfortunately wasn't prepared for this extreme event. Generators were too low, floodwaters rose, they lost power. And then you have to make these really, really difficult ethical decisions sometimes of who do you continue to provide care with the very, very limited resources that you have during these events. This is another interesting image. I'm based in Boston, and this is an image of storm surge during possible scenarios of different categories of hurricanes. I don't think it's unrealistic to think of hurricanes hitting high latitudes, hitting Boston potentially in the next couple of years. We saw Hurricane Sandy hit New York and the devastation that caused a few years ago. Hurricane Lee just last year went all the way up to Nova Scotia. So I don't think it's unrealistic to start thinking of higher latitude areas being affected by storm surge. This is what's predicted in Boston if we get a different category hurricanes again. The green showing the area that would be flooded by water. And it's overlaid by our acute care hospitals or level 1 trauma centers that provide care for the Boston community. And this would be devastating, right? If the waters are rising and basically taking up the area where basically all of our level 1 trauma centers are in the Boston metropolitan area. Imagine what that would mean for our ability to provide care for a community that's going to be even more strained during an event like this. So we kind of talked a little bit about how natural disasters lead to direct impact to healthcare facilities. But there's also a big population shift that can happen during events that can also then lead to more strain to some healthcare facilities. This is an image from Crisis Ready, which aims amongst many of their objectives to provide real-time data during natural disasters so you can make better real-time decisions. And this, I think, is from Hurricane Ian, as it's approaching as a Category 4, what's happening.
What's up, Doc? I missed you yesterday. I called you back, but you were already gone.
Oh, there we go. Category 5 for hurricane as it's approaching the southern coast of Florida. And you're seeing the red dots represent negative population changes, so people that are leaving a specific area, and the blue shades represent people going into those specific areas. So depending on where your healthcare facilities are, some areas are going to be seeing surges of volume of people they're going to be caring for, and how to make decisions on how to allocate resources better based on these population shifts. Because our world is so globalized, events that are happening in different parts of the world can also affect our ability to provide high quality care. This is a really interesting example in the aftermath of Hurricane Maria in 2017 that hit Puerto Rico. Obviously, Puerto Rico itself had a massive impact to their infrastructure. And an unbelievable public health crisis with loss of electricity. Refrigerators weren't working. They lost their refrigerated supply of vaccines. Public health, catastrophe. But they also lost it also affected their factory of normal saline, which provided normal saline to a lot of hospitals in the continental US. So hospitals that were obviously not directly impacted by the hurricane itself saw a huge effect on their supply chain of a component of care that is really important for IV hydration, for mixing medications, dilution of medications that is used for almost every single patient interaction. So again, emphasizing that things that happen in other parts of the world can also have substantial effects on our ability to provide quality care. So these are just some examples, mostly within kind of our own US care. now I wanted to transition a little bit about what do we do about it? How do we adapt? How do we prevent some of these strains to our healthcare system from becoming debilitating, or how do we improve our resilience so that we can bounce back after these events and continue to provide as high quality care as possible? The way that I like to think about resilience is that I see it in three big buckets. The first big bucket that I see is improving the health resilience of our community. So if we have healthier communities that are better educated with how climate is affecting their health, and they are better prepared with a plan if they are impacted by whatever climate hazard it is, then that by itself improves the ultimate health outcome after different climate hazards. The second pillar is how our healthcare facilities are going to be adapting to climate change. So this is, again, thinking of the actual individual hospital or clinic. Like, for example, we talked about Memorial in the aftermath of Hurricane Katrina. So how do facilities think through their operations and their specific climate hazards to better prepare to maintain operations? And then the third bucket, which I find really interesting, is how do the healthcare systems as a whole, not just individual hospitals, but how do we think about how we provide care as a system to a specific region, and how do we understand the hazards and how wildfires or hurricanes or storm surges are going to affect our general ability to provide care, and as a system come up with a plan to be able to maintain operations to the larger communities. Are you guys with me? So I was just going to dive a little bit deeper into these three buckets of health resilience and adaptation. So community health resilience, like we talked about, is improving the individual's understanding of what their risks are, so that they can be better prepared. So a big component of this is just direct education. And what we think about as physicians, as healthcare providers, is how can our role as healthcare providers improve when we communicate with patients to increase their agency to make better plans during natural disasters. So this is just a small facet of improving community health resilience. The healthcare system is just one of the many stakeholders that needs to be involved in this massive effort to improve our understanding of how climate is affecting our health. Some of the tools that I've seen apply that I think are gaining a little bit more traction are discharge instructions. So when patients come into the hospital, they come to the emergency department, they get discharged. Depending on their risk factors, we can provide catered education on if you have high blood pressure, if you have diabetes or kidney disease, what specific risks are you at, what specific climate hazards are you at higher risk for, and how you can create your own strategy to better prepare for those climate hazards. I think in this part, like I was mentioning, it's really important to involve other stakeholders. And this is where I was hoping to open the floor to the folks that are still in the call. I don't know, Justine, if it's still a good idea to do so.
Yeah.
Yeah. Again, I think that this is a really powerful tool that we have. Like, making communities healthier is the #1 thing that we can do to improve overall health outcomes. And the healthcare interface with patients is just one facet of how we're going to be able to achieve this very ambitious goal. And I think we have a lot of diverse skills in this platform, in this Zoom room. And I'm curious to hear your thoughts of how you see maybe this interplaying within your own field of expertise. I think the extension of the direct person, individual patient education of climate hazards the next step would be helping individuals create an action plan. So if you live close to an area where it's very prone to heat waves or wildfires, like it was when I was practicing back in Southern California, how do you help people create a plan of, if it's wildfire season, what exactly are you going to do to protect your health if you have asthma or COPD, just helping people take that next step in their own preparedness. Another strategy is making sure, if you're in an area where you know a specific natural disaster is going to hit in the next several days, several weeks, preparing your community. So doing things like refilling medications for people that are dependent on life-saving medications. Pre-hurricanes, a lot of communities that are prone to hurricanes will dialyze their patients before the hurricane hits, so that if they lose access to dialysis, lose infrastructure, at least you have a little bit of a buffer to get people through kind of the immediate impact until some of that infrastructure is restored. Preparing people, we talked about the populations that are dependent on the electrical grid to power medical devices at home, understanding where those people are and having better communications with them, making sure that they have a specific plan of how they're going to maintain their electrical grid to continue to power these medical devices at home. And then there's other public health strategies that are being thrown around and starting to be tested. So what does it mean? How does it change a community's resilience, for example, to heat stress? If you have a massive public health program that helps people that don't have air conditioning in their homes set up an air conditioning and have a strategy to maintain their air conditioners running through heat waves. Strategies like urban forestry can also decrease heat stress in urban heat islands. So there's a lot of things at an individual level that you can do at a community level to improve overall community resilience from a health standpoint. Any interesting comments in the chat?
I don't think we have any comments yet, but we do have a question about the role of local government, which we could talk about now or later.
How about we get through the two other pillars and then we address some questions?
Do that.
Awesome. I just wanted to share an example of the actual application of these patient education toolkits that I was talking about. This is a program that is being developed, again, by my colleagues at the School of Public Health. And this, I just wanted to give you guys a tangible example of like how this might be applicable in the clinic to patient interface. So we've developed a set of educational materials for clinicians to understand what the climate risks are for specific patients with medical conditions. And then we take it a step further of how physicians can educate their patients to help them create an action plan. So the one that I have up here is an example of the heat action plan that physicians have access to. They can, self-educate depending on what risk factors or what climate hazards their immediate community is most at risk for. And then they can even use some of the material to directly either verbally communicate some of the strategies or directly provide that material to patients so they can also continue their own education at home. Moving on to healthcare facility resilience. Again, this is how hospitals, facilities itself can better prepare for specific climate hazards. Some of the things we kind of already talked about as we were going through examples of how climate hazards are affecting health infrastructures, developing better flood protections, making sure that backup power generators are not placed in low-lying areas of the facilities if your facility is prone to flooding, either from storm surge or hurricanes. having architecture, buildings that have fire protection, that can withstand direct hazard from encroaching fires. Anticipating how staffing models might need to change depending on climate hazard that is going on. So we talked about how presentations to the emergency department tend to increase in volume when you have a heat wave. So using historical data maybe to anticipate what volumes you should expect depending on the length and the net temperature change during heat waves, maybe you can better prepare from a staffing standpoint. So during a heat wave, have more doctors, more nurses, more techs to be able to continue to provide timely care for anticipated increases in patient volume. Providing better transportation and housing for staffs. If you're in a scenario where maybe it would be very difficult for staff to come in and out of the facility, maybe having a plan of how you can provide the resources staff need to make it to the hospital, or even stay in the hospital or in the local area if they live far away, so they can continue to provide care to patients. Having obviously protocols in place within hospitals can also be very helpful. So having protocols for what do you do when you have a patient that comes in with symptoms consistent with heat stroke, where the faster you're able to pull them down, the better, and any delay in that care can lead to worse outcomes. Having protocols in place to be able to assist providers in getting the supplies they need to provide as quick cooling as possible, that can also be another strategy at a local facility level that can have pretty substantial improvements in mortality. We talked about how events in other parts of the country can affect our own supply chain, or other parts of the world can affect your own supply chain. Having a system that is able to identify where those vulnerabilities in supply chains are and maybe have redundancy in your supply chain can be another strategy to protect your ability to have the equipment and the medications that you need to provide care. And obviously this kind of ties back to the community resilience, but having providers and staff that are educated on the health impacts of climate change is incredibly important, so they can then change their practice or anticipate conditions that might not have been as common in a world without climate change, but now we're starting to see different spreads of vector-borne diseases, different spreads of Lyme disease, malaria, dengue, and having providers that understand how climate change is affecting the conditions that we're seeing, the frequency and the geographical distribution can also be very important in being able to maintain high quality care. As part of the Biden legislation to decarbonize the healthcare sector, they also encourage a lot of hospitals to, as part of their pledge, to also create an adaptation plan. So this is a step in the right direction, I think, of how the federal government is really encouraging and thinking through not just how we need to decarbonize and we need to mitigate every possible degree of warming, but also acknowledging that we're already seeing a lot of strain to the healthcare system, and there's federal incentive to have hospitals start to think about this and create an adaptation plan. These are some of the organizations that signed the pledge. Again, I want to celebrate the small wins because this is an incredibly ambitious and complex project for the healthcare system in the next couple of years. So having federal support and federal incentive, I think, is a huge step in the right direction. So I just wanted to celebrate the small wins with hospitals that have already signed the pledge and are committed to not just mitigate, but prepare and and understand their vulnerabilities and create an adaptation plan for the next couple of years. So finally, thinking of our third pillar, which is kind of the broadest pillar of health systems adaptation. So how do we as a healthcare system, how do facilities as part of this bigger healthcare infrastructure think how they can collaborate with each other to maintain operations during weather events that obviously are not just affecting one facility, but sometimes affecting many facilities at once. So these are things like cross-credentialing providers. So as a doctor, you're typically only credentialed at one facility, but if your facility is being affected by a heat wave, by a storm surge, and you're not able to operate, then your ability to provide care is basically gone. But if you're cross-credential at another hospital that's maintaining operations, maybe you can help with that volume surge that another hospital might see during these climate hazards. We talked about using real-time data to anticipate where the shifts in demand are going to be. And this is obviously data that can help the entire system better prepare and allocate resources in a smarter way to anticipate shifts in population. Another, I think, maybe a naive dream would be to have communication between EMRs, electronic medical records. So if a patient is seen at a hospital, but that hospital is not able to operate because of a climate hazard, and the patient goes to a different hospital that doesn't have the same electronic medical record, then we have no idea as providers what their medical history is, what their medications are, what recent care they received. And you're caring for somebody basically in the dark without having access to that prior history. So in an ideal world, we would have communication between the electronic medical records, especially during extreme weather events, natural disasters, so that you can maintain that continuity of care as best as you can with as much information as possible. And then knowledge exchange between hospitals. We're going into a period where obviously adaptation is so important, but it's new. Nobody has developed a gold standard of how hospitals should adapt. And it's also very specific to each facility. Each facility is going to have their own climate vulnerabilities, their own hazards, their own patient population, and not one size fits all. So I think that shared collaboration between facilities, sharing knowledge of successes and failures, so that we can continue to get as much data and validation as we move forward, I think is going to be also incredibly important. And I think we're going to skip these slides. Again, I just wanted to kind of point out that we're starting to think about this pretty aggressively. There's a lot of protocols that have been proposed by many important stakeholders nationally, internationally. And I think our role in the next couple years is going to be to really still down a lot of these recommendations and start building more robust data of what works and what doesn't work. But I think we're moving in the right direction. And again, there's a lot of information out there, and hospitals are starting to care more about this and recognize this as a big issue. So I look forward to being involved in the process. And again, I want to emphasize how important it is, not just for healthcare facilities to collaborate within the system, but I think there's so many stakeholders that are incredibly important to be able to provide care and improve health of the community as a whole. So the collaboration is not just going to happen at the healthcare facility and healthcare system level, but with a variety of community stakeholders. So again, I look forward to being part of this process with you guys. So just a couple closing thoughts, and I would love to hear some feedback and hear your thoughts on this very complicated topic. But climate change is happening now. We've already seen 1 degree Celsius warming. We're already seeing worsening climate hazards throughout the entire world within our own communities. Obviously, every degree of mitigation matters, but if we fail to prepare for what we're already seeing, we're going to be preparing to fail. So mitigation is already important. How much we have to adapt, sorry, not mitigation. Mitigation is important, but adaptation is already important as well. And how much we're going to adapt is going to depend on our mitigation efforts. And adaptation can happen at multiple levels. Health adaptation specifically can happen at multiple levels: at the community, at the healthcare facility, and as a system as a whole. And again, widespread collaboration is going to be absolutely key as we move forward with some of these efforts. I'm going to stop there.
Thank you so much, Catharina, and also to those who joined us late and persisted. I think we're a small group, but you're a very dedicated group with all of the twists and turns in our platform this afternoon. I think this, I mean, it's an immense challenge, but you brought together the threads and dimensions of it so well. I want to open the floor if there are questions to put them in the chat. Otherwise, I'm happy to ask some, but maybe we'll stay on for another 5 or so minutes.
I think we had a question earlier in the chat that maybe we could address.
Yeah, going back to the question about the role of local government in supporting a resilient healthcare sector. And there was also a note there, like especially with the idea of climate migration and changes in population density and where people live with climate change.
Yeah, those are big questions. Let me try to address the migration question first. I think there's 2 types of displacement that can happen. There's temporary displacement, where a hazard might come in, a hurricane might come in, floodwaters are going to surge. People are going to displace temporarily, but they might be able to come back to their community. And there's the more permanent type of displacement, where area is getting affected so frequently that it's no longer viable for people to rebuild every single time, or an area might become uninhabitable because of crop failure, drought, food insecurity, and cause more of a permanent shift in populations. And the way that the healthcare system would fit into those pictures, I think is, I don't know that I have a great answer to that. I think for permanent displacements, if you're losing populations in a specific area, maybe healthcare facilities in specific areas are going to become obsolete. And we just need to rebuild in areas that are receiving populations. And if a hazard is a temporary hazard, I mean, the healthcare facility is going to have the same challenges of the population of rebuilding and, again, optimizing operations as a facility and as a healthcare system to be able to withstand that temporary displacement of people. There's all other scenarios where you might not have complete displacement of an entire population, but you might have enough climate pressure that are forcing some people to move. And we're seeing increased numbers of people migrating from all parts of the world because of droughts and natural disasters. And it's very difficult to directly blame climate change, but I think that it's okay to say that climate change is a trigger that forces migration. And the other interesting question that I have is, how do we, as providers, give better care and understand these patterns better so that we can care for people from other parts of the world that are now entering our healthcare system with different disease burdens, with different baseline health that speak different languages. How do we better prepare and understand these patterns so that we can continue to provide care for these populations that might be entering our purview? And the second question about local governments supporting some of these efforts. I mean, we reviewed how the federal government is incentivizing hospitals to not just mitigate, but also adapt. To be honest, I wouldn't be able to give you too many examples because I think this is very location dependent. But I can speak for LA, for example, where LA County has a sustainability office, and they've in the last couple of years generated a vulnerability assessment of what communities are vulnerable to what climate hazards. And I think the intention behind that is to help facilities understand what their local vulnerabilities are, so they can then better plan adaptation strategies. So I think there's different ways that local governments can support by providing data, by helping facilities assess vulnerabilities, and by providing political financial incentives to do so. But off the top of my head, I don't have too many specific examples to share.
And it seems like there are a lot of avenues for growth and development, whether that's about bringing the data to the community-based data to the healthcare system, or about the data and information and awareness and sharing between. That this is like how we gather information and how we understand it and share it is a huge challenge.
Mm-hmm.
Better preparedness and better outcomes. Okay. I don't know if we have any other questions we want to ask. I guess one question, just in the limited time we have, I'm curious, in your experience as a resident and as an emergency medicine practitioner, if there are changes you've seen, either just like in a personal sense in the day-to-day operations that you've seen affected or put into action in the last 10 years through your own experience.
I think my personal bias as somebody that practices in the intersection of climate change and health is that I don't think that we're doing enough fast enough. I see small changes. I see people starting to think about how to better educate their patients, like small initiatives starting up, like the patient toolkit that I shared with you. Hospitals starting to think of, let's not put our generator in the bottom floor, let's elevate our backup electricity supply so that we don't lose operations during floods. So there's small things that are being done. And I think the 61 healthcare systems that have signed on to the pledge is basically hospitals saying, this is important to us. We agree that this is going to be a significant strain to the healthcare system, and we need to create a plan. So all of those little things are steps in the right direction. But I think my personal bias is I would like to see it happen faster and more aggressively. But I do think that we're making steps in the right direction. And I think there's much more acceptance. I think the first most important thing is people to understand that climate change is affecting health, that climate change is real, and it's having profound implications to our communities. And I think from that standpoint, we're making really great progress.